Check. Check. Test. Check.
She said start. Then I will start mine. Yeah.
3 minutes.
He's going to introduce it. So he's going to call everybody. on- What's it?
Good morning, everybody. I request everybody, every one of you to take your seats, please. And we're going to have a short inaugural session. And I would like to introduce Dr. Uday Shivangi. She is the chair of this particular RPGHS from USA. And please come over and take over the proceeding. And before that, I would like to invite all my esteemed guests who are here to come out and onto the dais. May I request Dr. Anupama Gotimukula, the president of API, to take the seat. And may I request Dr. Ravi Kolli, the president-elect of API, to take the seat. And we have with us Dr. Satish Kattula, the secretary of API. And I may request Dr. Lokesh Edara, please come out to the dais. And before we would like to call upon our guests, esteemed guests over here, Dr. Minu Bajpai, please come out to the dais. And may I request Dr. D. Nageshwar Reddy, the chairman of AIG Hospitals, please come out to the dais. And we have another guest of ours, Dr. Surya Narayan Raju. Please come out to the dais, please. May I request Dr. Uday Shivangi to take over and continue the proceedings, please. Please come.
Thank you, Dr. Dwarkanath Reddy garu.
May I request Dr. Kishan Kumar, please come out, the treasurer of it to come out to the dais, please. And I think the another important person with us we have is Dr. M. Sampath Rao, the president of Indian Medical Association, Telangana State. Please come over and occupy the chair, please. All right. No, don't bother. I will be here.
Okay.
We'll be here only.
Yeah, please. Namaste. Good morning, everyone. Honorable dignitaries, delegates, ladies and gentlemen. On behalf of the American Association of Physicians of Indian origin, the entire organizing committee, I wish to extend a warm welcome to all of you to the 15th Annual Global Healthcare Summit 2022 in Hyderabad. I am Dr. Udaya Shivangi, and I'm delighted to be with you all today. It's my pride to keep coming to my roots, the country where I was born, the country which gave me my identity, education, and culture. It's time to give back to India so that we can together build a healthier nation. Let's begin today's program with our national anthem. I request every one of you, please rise,
1 second.
join the chorus.
Before national anthem, may I request Dr. Sujit Punnam, the chair of the CHS from America, to please come and occupy the chair. National anthem, please. Why they take so much time?
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Please take your seats now. We will begin the event by lighting the ceremonial lamp. As we all know, light symbolizes the positivity and victory of truth and knowledge over darkness and ignorance. Now, I would request all our dignitaries to come forward and do the ceremonial lighting ceremony.
Thank you. I think we We have with us also, I would like to introduce Dr. B.N. Rao, the President-elect of Indian Medical Association, Telangana State. So,
Now I would like to invite the inspiring and passionate women leader who always led with immense positivity, the one and only, the president of API, Dr. Anupama Gotimukula, to come and give us the welcome speech. Please put your hands together. Welcome our president, Dr. Anupama Gotimukula.
Namaste. Happy New Year. And welcome to all the delegates, invited guests on the stage, and our panel speakers, and everyone in this room, the medical students, and everyone participating in this very memorable summit. We all know how we are inside our feelings today. I want to extend my warm welcome to all of you to the 15th Global Healthcare Summit in the historic city, Hyderabad, at this Hotel Avasa today. API is American Association of Physicians of Indian Origin. We are 40 years old almost, and we formed the organization in 1982 by a handful of physicians. And now we are more than 100,000 physicians in the United States, and almost 1 in 7 patients in United States is seen by a doctor of Indian origin. And our patients love our services. We have a very good reputation in United States. Since its inception, API has been striving to deliver healthcare to those living on the fringes of society, both in India and United States. The pandemic has brought us more innovative opportunities to connect, network on digital technology platforms, transforming healthcare to be more accessible globally. And during this pandemic, our physicians have done thousands of free consultations in this country to the very needy people who were really dying at that time when COVID pandemic started. In the past, API has taken several projects for India. Our love for India cannot be taken easy or light. And this year, API is working on several projects, and this is a platform for API to present what we are doing for our mother country. This year theme, we picked prevention is better than cure. It looks very simple, but it's not. Our goal is to help and focus, bring the awareness of preventive screening and help develop. Like in United States, we have United States Preventive Task Force. They make the guidelines, all the screening preventive guidelines. So we want to help India to develop its own guidelines of preventive screening and form this structure like Indian Preventive Task Force. And everyone in this room is a leader, and let us put that seed in our thoughts and efforts today. And India has so many non-communicable diseases, which are like silent killers. So the awareness, we are here to bring that awareness of these are the silent killers, and we need to address those. So API has done this Adopt a Village, and we have adopted 75 villages, rural villages. It's a 75 years of independence. In that connection, we thought, let's do something for India this year. So we have adopted 75 villages as a pilot project, and in 5 states, but we are going to extend more states. So we picked 5 states: Andhra Pradesh, Telangana, Karnataka, Tamil Nadu, and Gujarat. And because of the services they have already here, so we thought let's start. And the global teleclinics, with collaboration of them, we are able to do this service. So what we do is all about it. Dr. Katula will go more about it. And the second initiative is education, medical education. What I have, when I graduated back in 1980s, and now there's not much change, but there's more change needed. And we want to make sure that every MBBS student will get one post-graduation seat. So Global Medical Education Chair, Dr. Lokesh Idara, he's on the stage. He will be explaining more what exactly this committee is putting forward for this. And so for the medical students, they have a lot of goals. They want to go for higher education to United States like we did many years ago. But the current situation is in 2024, every country who would like to go for further education, postgraduate education in United States, they have to be accredited. The country has to be accredited by the World Federation of Medical Education, which is a WHO initiative. It's a standardization of medical education. So API has started the efforts last year. Fortunately or unfortunately, COVID pushed it from 2022 to 2024. So we have time. So we had several meetings with ECFMG and WFME representatives. And also we are trying to get our connection with the NMC, which is a very new body. So they are like budding in the infant stage. So they are also trying to help us. And I think by 2024, the medical students, I think they should be able to pursue their education in United States. And that'll be a big achievement for the students. So API is very much motivated to help these students to pursue their education in US. And API is almost like we are 365 days in India. Our thinking, our thought process is like, let's do something. So we made this in API India Foundation, which is like a 501c3 in United States, so we can do more charitable activities. So without much delay, I want to thank all of you and welcome. And most important, let us follow the COVID precautions. Everybody, please do wear masks and maintain those social distancing and use hand sanitizers as often as you can. None of us in this room should leave with any COVID positive. That's our goal. So let us work for ourselves and give us a big hand for being here, and let's enjoy. Thank you, Udaya. And
Thank you, Dr. Anupama Gotimukla. That was very inspiring and illuminating words. Thank you. And
I would like to recognize the presence of Dr. Rangareddy, the past president of API, and Dr. Vijay Kohli, another past president over here, and also the president of OGKTMA, Dr. Vijay Gunuganti. Welcome.
now, thank you. I would like to invite the chair of API Global Medical Education, Dr. Lokesh Idara. He has been instrumental in coordinating with various medical colleges and encouraging student participation in research and medical education. Please put your hands together. Welcome, Dr. Lokesh Idara.
Sorry about the masks. Can you hear me? It is an honor to speak in front of you, especially my beloved students. I really honor. I working with you for last 3 years and able to see you face to face. And thank you so much. You give us energy. We're getting almost retirement age. Without your energy, I can't be going more. So his students, 60 of them, are representing 300,000 medical students in India, the highest number anywhere. What I'm proud of is your competition. One in the UK, if you have 8 students applying for medical college, 1 will get admission. Out of 8, 1 will get admission in the United Kingdom. In India, 18 students apply, 1 will get into the MBBS. So we are proud, you are smarter than anybody in the world. It is like 5th century Nalanda institutes where Chinese people walk 1,000 kilometers. It's very competitive to get in. So it is like that right now. Sir, next one. NMC bill passed. I know a lot of IMA is against it, but I am 100% favor to that, which you know in few years how good it is. So our presenting Dr. Suryanarayan Rasgaru will honor to have him. He will present what are the reforms. The NMC will, and of course DNB will take us the best medical students in India, in the world. You will be the best in the world. And I just visited Mangalagiri AIIMS. It's an awesome institute. I'm sure most of the AIIMS are like that. So what I request is AIIMS dignitaries, you are not in the, please adopt all the medical facilities, medical students of all colleges, your own students. And Dr. Mini Bajpai sir, honored to be here representing a DNB, which they are going to create an awesome number of postgraduate seats and 1 MBBS, 1 PG seat. That's Niti Aayog, 100,000 PGs. They are going to give us more information. So API is going to, and work with hand in hand with medical students, faculty, and research. And believe me or not, in USA, it costs $16,000 to recruit 1 patient in double-blind placebo studies. We can do cheaper, we can do more product, we can show the world what the best, which you're already doing. Sir, AEG President Sir is here, Nageswara Reddy Garu doing awesome work, and also everyone here. And the last thing which I'm going to mention, IRCF, Indian Resuscitation Council Federation, is made in India. It's like AHA body, and we have many members of us here. And we have a lot more things to come in the future. Thank you so much for your kind time. Appreciate it.
Thank you, Dr. Adara. That was quite amazing speech. Thank you. You have done a lot to India as well as USA. Thank you. Now I would like to invite Dr. Ravi Kohli, the President-elect of National API, who's a practicing psychiatrist in the US. He has been a great leader in API more than a decade. He believes in his slogan, "When I do good, I feel good. When I do bad, I feel bad. That's my religion." Please welcome Dr. Ravi Kohli.
It's still good morning. Good morning, everyone. Thank you for all of you for being here. What a beautiful stage and what a beautiful location. And I want to applaud the local team who put some amazing effort into this at this show today. We are eternally thankful to you, Dr. Dwarakanna and his team. You work so well together. It's all smiling, laughing, having fun. That makes it really easy for us to come back and do it again and again. And I want to thank all the guests of honor here for being here, taking time from your busy schedule. I know you're very busy people, and thanks for being here. And I want to also thank all the delegates from USA who came in spite of hardships with the COVID vaccination, COVID testing, and all the weather phenomena that has been happening. I really applaud all the leaders who are here, really, really, from the bottom of my heart. One of the theme of this talk today, this event is prevention is better than cure. So I wrote a small article about it. I'll read it a little bit from that. Prevention is better than cure, said Benjamin Franklin, my fellow Pennsylvanian, who is one of the founding fathers of America, who signed on 4 important documents. $1 used for prevention saves $14 in treatment costs. So, but it is much neglected area of healthcare because our healthcare is more of a sick care industry, and it doesn't pay for prevention. It pays for treating the illness, not promoting the wellness. So that's very important. We need to have a paradigm shift because we cannot go on this phenomenon of spending, ever-ending spending, escalating spending to treat illnesses. We need to prevent the illnesses. So prevention is the best thing that we can do. There's a saying in Telugu, Alasyam Amritam Visham, meaning if you delay something, a life can be turned into death. So if you delay care, health care, your life will end up in death. And also from a personal point of view, I paraphrase into Alakshyam Amritam Visham. If we neglect our health, Alakshyam in negligence of our physical health, well-being, we're going to end up in illness. So from a societal, governmental, provider perspective, Alasyam Amritam Visham, without delay, treat the illnesses. From a personal perspective, don't neglect your health. Like Anupama said, non-communicable disease burden is phenomenal, it's growing. India is the capital of this non-communicable diseases. So we need to address it. And also again, during this pandemic, we found out prevention is the way, vaccination is the way out of this pandemic. So we need to focus on science-based, evidence-based treatments. And there's a lot of misinformation going on. As a physician, as a student, it's your job to educate the public on what is right and what's wrong, what is evidence, what's not evidence. So your job is cut out for you to take leadership in organizing medicine for betterment of the society and the communities. So I don't want to take too much time. I just want to say prevention is better than cure by any means. For example, if somebody is stopped from jumping into the river upstream, you're saving him. But of course, the TV doesn't show you that. If somebody jumps in the river and you rescue him, the TV will show you the breaking news. So that is the sad part. The bad things get publicity, but not the good things. So we need to make sure all the good acts we do for prevention of health and illnesses, we need to make sure it is a glamorous field, a glamorous and recognized activity of physicians. So let's start with from the students to focus on prevention. So let's continue on that theme again and again. Thank you so much for your kind attention. I hope you all are having a good time. Like Dr. Anupama said, wear your mask, stay away from each other as far as you can. Thank you and have a good day.
Thank you, Dr. Ravi Kohli. Let me start introducing our dignitaries. Dr. M. Sampath Rao, President of Indian Medical Association, Telangana State, to come forward to say a few words.
Good morning, everyone. అందరికీ నూతన సంవత్సర శుభాకాంక్షలు. ఇండియన్ మెడికల్ అసోసియేషన్ తెలంగాణ స్టేట్ తరఫున నేను మా మిత్రులందరూ ఇంక్లూడింగ్ డాక్టర్ ద్వారకనాథ్ రెడ్డి, our President-elect Dr. B.N. Rao, all other my colleagues, we bring warm greetings on behalf of the Indian Medical Association to all of you. It's the API, American Physicians of Indian Origin, is a very, very, very instrumental in carrying out the service activities in India by their active participation. Not only the updating of the doctors' knowledges, but adapting the villages. Now their slogan is 75 villages on the occasion of the 75th year of the independence of the India. So these are very laudable projects, and Dr. Dwarakanath Reddy is a global coordinator. He is an international man. He's seen everywhere. His foot is everywhere. So Dr. Nageshwar Reddy, the chairman of the AIG hospitals, is the academic stalwart, not only running the corporate hospital, but he has got a lot of passion in the development of the academics activities. Dr. Anuradha, Dr. Ravi, Dr. Udaya, Dr. Vijay, and all others, I congratulate all of you for organizing this sort of activities. The Indian Medical Association, Telangana State, with its membership of nearly about 17,000 members, nearly about 70 branches, we can coordinate with all of you in the activities of you. Wherever the nook and corner of Telangana, not only at Hyderabad, we have all our network, we can definitely. And during my tenure of the presidentship, I am giving much importance to the public service activities. So we will be glad to also associate with OPI in this aspect. Because, so I give the organizers all of the best, and I thank the organizers and all of you for giving me this opportunity. You should excuse me that I have got to go somewhere. I will leave with that. Thank you, one and all.
Thank you, Dr. M. Sampath Rao Garu. Thank you so much for lovely speech. Now, I would like to invite our next dignitary, Dr. Meenu Bajpai, who's the professor and head of the Department of Pediatric Surgery in AIIMS, New Delhi. He's also the Vice President of National Board of Examination in Medical Sciences. I would like, please put your hands together to welcome Dr. Meenu Bajpai.
President, American Association of Indian Origin Physicians, Dr. Anupa Gotimukala, Chairperson Global Health Summit, Dr. Udaya Shivangi, Chair GHS India, Dr. Dwarkanath Reddy, Chair AAPI Global Medical Education, Dr. Lokesh Idara, members of this August gathering, dignitaries on the diet, those who are physically present, the students here, and those who are globally connected. A very good morning. It's a privilege to be amongst you. That the AAPI is celebrating its 15th Global Summit is no mean achievement. It shows the dedication and contribution that you have been making over the years and sustaining it. There is a slew of activities which you have conducted in the past, and there are a slew of activities which are lined up for the next 3 days. It is very encouraging, very motivating, especially to the medical fraternity of India. Now, I represent our board of National Board of Education and Medical Sciences. NBEMS, as it is short named, was established in 1975 primarily to complement the activities of the then Medical Council of India, now known as National Medical Council. The idea was to complement by increasing the number of postgraduates in the country to make more specialists. Now, over the years, considerable work has been carried out. Primarily, NBEMS was an examination conducting body. How to reach out to students for framing questions, checking of copies, formulating questions and making innovations, how the examination pattern could be improvised. So over the years, we have also conducted surveys and policy sort of interventions as far as accreditation of hospitals in India are concerned, and also to make them eligible or identify their eligibility criteria, identify them whether they can impart quality medical education to see vis-a-vis the number of faculties which they have. So all this has been happening. It is a matter of concern for all of us, both at NMC and NBEMS, that we increase the number of postgraduates in our country and the number of super specialists and specialists. We have come a long way. Still, there's a lot more ground to be covered. An ideal scenario would be a ratio of UG to PG of 1:1, or 1:2 actually. And many countries have inching towards that, but we are on the left side of the spectrum. It is not that efforts have not been made. We have made a lot of efforts besides NMC, which has made a monumental contribution. The National Board has also made greater strides. At the most, we are now 15,000 strong postgraduates, and this is a very steep increase. Now, there are strengths of NBEMS and there are challenges. To give you some factual position, our biggest strength is that we cater to hospitals, which are mostly private hospitals, where the training programs are being run. If you compare the conventional training institutions, which were medical colleges, which were training heavy, academic heavy, when we went to the hospital scenario, it was realized that the training and education impetus was missing out of them. The service was overwhelming them. But this gap is fast bridging up. And the challenge that we faced was that often we found stand-alone hospitals which have the capability to impart postgraduate courses sometimes fall short of numbers. Number of beds may be less. Teachers who can contribute and part of the stream may be falling short of some eligibility criteria. So these standalones were actually going into negative. That is, we had to take them away from the mainstream of accreditation. This was a major concern. So you can imagine a significant number of those hospitals which had substantial material was not being utilized because of our currently available eligibility criteria. Therefore, if we pool our resources, make hubs of these hospitals together, suddenly the number would increase. That was the main guiding force of the current governing body council of the National Board of Examination, headed by Dr. Abhijat Sheth, who unfortunately couldn't come this time, but he is our guiding light and force because he's very proactive and he encourages all of us in the board to do these activities. So one part was that, club up available resources so that they don't fall out of our definitions, rather redefine our definition so that without compromising on quality training, we could have resources for our country to be built up vertically up. Now, second part was improving the lot of the trainers of trainees, the teachers. We had some clauses where we would say that a junior consultant is not qualified to be a junior consultant for teaching because he's falling short of some years, etc. And when you pass out your MD or postgraduate course from a medical college, you do some years of senior residency, you are remaining in the academic environment. But often many people can't continue in the same academic environment, either because of non-availability of seats or for personal consideration, they want to go in for private hospitals. Now, by the time they become eligible for becoming teachers or junior consultants, it takes about 4 to 5 years. And if they are not connected to academics right after they step out from academics, they lose out, they become roughened. And we have made now, going into a policy that we would engage them right from day one, and we will put them some figures like for accreditation, some CME points, some publications, a few of them only, so that they are connected to the stream. And in very short period of time, they become junior consultants. So increasing the number of trainers for trainees, increasing the number of those hospital hubs, which can then contribute to more postgraduates, is what is being done. We have already taken a decision. We have started the activity. It is still not, it's not in the papers alone. We have already conducted about 6 weeks back the specialty board of obstetrics and gynecologists. As you all know, often in the private hospitals, the gynae part is more, and in the government setups, it is the obstetric part which is more. So therefore, if we club the two, we suddenly find that a lot of clinical material available. We discussed this agenda with the specialty board of Obs Gynae, and they were all for it. So we are now making an MOU so that these hubs of hospital can start working together. And this module is going to be reciprocated throughout the country in all specialties. NBMS under its framework now has more than 84 specialties. You can imagine that the spectrum is mostly covered. We have got DNBs, we have a super specialty called DRNB, we have fellowship programs. And about 2 years ago, we introduced diplomas, which is a 2-year course post MBBS, so the numbers can increase. We thought that it will help, and it is helping also. But in this period of next 10 years, we will see how it's working out. So this is all what we have done. Now, in terms of improving the quality of education of the trainees, I'll say something about what is called as competency-based assessment. For the postgraduates who are in hospital, who are the trainees actually, they should get the maximum benefit from the clinical material and academic inputs. So we are doing it a two-pronged approach. As I said initially, the NBMS were primarily an examination conducting body, but we have taken our role little higher level. Now we have created an education hub, the information technology hub within NBMS premises. So we would then carry out exercise. We have about more than 150 talks going on round the clock every morning from the NBMS headquarters. So these talks, these case-based discussions, to and fro activity between students and teachers is going on. This information technology hub will impart state-of-the-art lectures to all the postgraduates. And then to make an assessment, we have introduced a system of competency-based assessment. And for the youngsters, I'll speak a minute only. If you, Dr. Shivangi, just for a minute, can I speak? Time is up, so I'll just mention one. I'll continue in the panel discussion, but competency-based assessment, which is a form of formative assessment, has got 6 domains, and each domain is assessed by 3 milestones. Each milestone has performance levels, which are 2 levels for undergraduates and 3 for postgraduates. We will discuss it much later. We are introducing it on behalf of the MDBS. Thank you so much.
Thank you, Dr. Meenu Bajpayee. That was a very informative speech. Thank you. Now, I would like to invite our next guest of honor is Dr. Surya Narayana Raju, who's a surgical oncologist and founder of Surgical Oncology Unit in NIMS, Hyderabad. He is also a member of National Medical Council Assessment and Evaluation Board. He has over 35 years of experience in surgical oncology. Please welcome Dr. Surya Narayana Raju garu.
Good morning, everyone. I wish you a happy new year. In this occasion, I thank the members of API for thinking around the year for several years about medical education and improvement of services in India. Not only thinking, actively participating and inspiring in medical education in India and also the services provided by frequent CMEs and also interactive sessions. I have participated even earlier here. When we conduct such interactive sessions, there will be an inspiration and also to identify the deficiencies between the Indian education and practices and also in American. By that, we will rectify ourselves. What we find here, the API is so active and they have been guiding and also giving suggestions time to time. For last 1 year, I am observing that. How to improve, what are the important areas to be incorporated in medical education. Medical education is a challenge in India, especially we have entered into National Medical Commission in difficult times when nothing was happening there. The initial observations were that doctor-patient ratio is not enough, but later realized when we take other doctors' communities into considerations, it is not so less when compared to the other countries, but the distribution of doctors, distribution of medical institutions in the country is a major challenge. All of you are aware the difference between urban and rural distribution is really a challenge, and also we need to do a lot to balance between urban and rural. Even the institutions are crowded in some areas and not available in large and also in some undeveloped or some states. where the education as well as medical services are not readily available. When it comes to the doctors' population, the target was about 100,000 doctors for this country. We have 92,000 and odd doctors for this year, with MBBS seats I'm talking about. Nearly 8,000 new seats have been created in this academic year 21-22. Similarly, when it is planned for postgraduate courses, though the targets are very high, we also have a lot of limitation in this current year because of COVID. When we wanted to see the recognitions and increase of seats for some colleges and institutions, the concerned specialties have limitations of not having patients, not having clinical work, not having required surgeries, which are the basic criteria for the postgraduate education. Similarly, the type of courses, number of courses, and specialties, once again, broad specialties actually are the priorities, and super specialties we are trying to redefine, and also the nomenclature, some repetitions are there. What is important to the country, what is important to the common man, what is important to the areas and geographical distribution also have been scientifically studied. Another important point I need to bring it to the audience notice is the students of Indian origin going for graduation education in some Asian countries are nearly around 30,000 students per annum. Really, it's a great challenge for us. Of those students who are going there, having the training for 5 years, when they come back, are they really trained and can meet the needs of the population? When we see their qualification and passing the qualifying examination, FMG in India, the percentage of pass, if you see, it is very disappointing. About 15% to maximum 30% from some countries. What is the future of remaining graduates when they come back from such countries, and what do they do with the degree is a major question, and also we need to do something on that. Keeping all the factors, probably there are a lot of reforms have been brought in the National Medical Commission. Probably in the afternoon session, we are going to discuss further details and try to take advices from you and take it forward. I once again thank API for giving me this opportunity to participate. Thank you so much.
Thank you, Dr. Suryanarayana Rajagaru. Thank you so much. Now our next dignitary, Dr. Nageshwar Reddy, Chairman of AAG Hyderabad. He's a world-renowned gastroenterologist. He is Padma Shri and Padma Bhushan awardee. He will be receiving Doctor of Science from Nagarjuna University tomorrow. He will also be receiving Nageshwar Rao Reddy is also chairman of AAG Hospital, Hyderabad. Not only that, he's a world-renowned gastroenterologist, and he'll also be receiving Lifetime Achievement Award from World Gastroenterology Society. Please put your hands together. Welcome, Dr. Nageshwar.
Thank you very much, distinguished guests on the dais and friends. First of all, I'd like to thank API for giving me this opportunity to be here this morning. I've always admired API for 3 reasons. First is, as an outsider, I look at it, the service they provided to the United Medical states, the service they provide, because 70 to 80,000 Indians are practicing there. 1 in 7 patient with a medical problem in US sees them. And if tomorrow they stop working, I think the medical services in US would collapse. So that is the strength they have. The strength is further justified by the factor that RP has become a very strong lobby in US now. Most of the thing in US is by how strong a lobby you are, how you can lobby with Congress and so on. The lobby has become very stronger here. In fact, from President Clinton, the previous potential presidents who are going for elections would approach RP and come for a dinner. And in fact, last time it was, I think Clinton, last I heard of, and of course Trump was trying to do that. I think Prime Minister Modi also addressed your Congress in last dinner. So this shows the power of RP. The second important thing about RP is I've had a close association with many academic giants, Indian academic giants in US, especially in the field of gastroenterology, many members of RP who have contributed significantly to academic medicine in the world. They have written several, for the students there, they've written many papers, several chapters, they're editors of textbooks, and they influence medical thought all over the world. And I think that's a significant contribution. The third most important thing, what I've been seeing in recent years, is the socio-economic aspects of RP. In fact, they've started wanting to give back to the country they came from. And I think this is extremely important, probably as important as the other two. And over the few years I've been associated, in fact, Dwarak has been a strong force here and is coordinating many of the activities, adapting villages, medical education, and recently in the COVID period also they contributed a huge amount of material knowledge and so on to what's happening in India. I think this is a very significant contribution. And on behalf of the Indian physicians, we are very grateful for what RP is doing, for all you're doing to the Indian community. So thank you very much, RP, and I'm extremely honored that I had the privilege of being here with you this morning. Thank you very much.
Thank you so much for the lovely speech. And now, our chief guest today, Dr. Honorable Vice President of India, Sri Venkaiah Naidu Garu, could not be here. However, he sent a video message which we will play now.
I request you to please play the video message, please. Come. Yeah.
Dr. Anupama Gotumakala, President RP, Dr. Uday Shivangi, Chair, USA Global Health Summit, Dr. Satish Katula, Secretary, RP, Dr. Ravi Kolli, President-elect RP, Dr. Lokesh Idara, Chair, RP Executive Member, Dr. D. Dwarkanath Reddy, Convener, RP Global Health Summit, dear doctors and dignitaries, sisters and brothers, I'm indeed very happy to inaugurate the 15th Global Health Summit organized by the American Association of Physicians of Indian origin today. I would have been more happy to have come and actually participate in the program as I agreed earlier. But you know, as the corona is spreading and the protocol advice is not to interact with the people and go for a gathering. At the outset, let me congratulate the RP for organizing this summit in Hyderabad with a focus on preventive, palliative, and lifestyle medicine and technology, telehealth and transformation. On this occasion, my hearty congratulations to the state of Telangana, which ranks in the top 3 states in the large states category in Niti Ayog's 4th edition of the State Health Index released recently. I'm happy to note that Telangana is on the top 3 states in the year-on-year incremental performance in health outcomes too. My compliments to the state government and all those associated with the health sector for this tremendous achievement. My dear sisters and brothers, over the past 2 years, the COVID pandemic has challenged our healthcare systems and has been reinforcing the need to double up our efforts in strengthening our infrastructure. I'm happy to see that the 2 new vaccines and an antiviral drug were recently approved by the Government of India to boost the fight against COVID, especially in light of the new variant Omicron. With the number of new cases in all the states surging again, it is imperative that we apply lessons of the past waves of the pandemic with a sense of urgency. We must consider it our dharma, our duty, to follow the COVID protocol at all times and secure ourselves and our community. We should also encourage those who are unvaccinated in our family, in our surroundings, to get themselves vaccinated at the earliest. The Government of India, in a proactive measure, has announced vaccination for the age group of 15 to 18 years, along with an additional precautionary dose to those above 60 years of age. These efforts will lend a sharp thrust to India's fight against COVID. I urge you all today to encourage the parents of the children in the newly eligible age groups to get their wards vaccinated at the earliest. Public-minded individuals, social advocacy groups, medical professionals, and the government must reach out to as many people as possible and get rid of any vaccine hesitancy that may be stopping us in our collective fight against the pandemic. My dear sisters and brothers, I am pleased to note that Indian firms collaborate with the US-based organizations to produce the 2 approved vaccines, Coronavax and Covovax. This experience clearly shows India-US collaboration in healthcare can reap great benefits, not only for these countries, but for the entire world. Here I wish to recall the fact that India's contribution to global healthcare is not a new phenomenon at all. Apart from being the pharmacy to the world, with the path-breaking innovations in the pharmaceutical industry, India has over the years became a much sought-after medical tourism destination of the world. The data reveals that nearly 7 lakh foreign tourists came for medical treatment in India in the year 2019 alone. Indian medical professionals, doctors, nurses, and technicians have been making their mark in every corner of the world and have been offering invaluable service for many decades now. It is estimated that there are 1.4 million physicians of Indian origin all over the world. In the US in particular, I am told, many Indian origin physicians have gained a formidable reputation in their respective fields. Several of them occupy the top administrative positions in the medical field in the country, including Dr. Vivek Murthy, the present Surgeon General of the United States, among others. These Indian origin physicians are a personification of our nation's cherished civilization value of Vasudaika Kutumbakam. They are among the most successful ambassadors of India's value system and propagators of our mission to share and care for all the people of the world, irrespective of their nationalities. We are indeed proud of them and their service. In this regard, it is noteworthy that API, founded in 1982, is one of the largest groups that represent the interest of more than 80,000 practicing Indian origin physicians in the United States and 40,000 medical students, residents, and fellows of Indian origin. I'm happy to know that during the second wave of the COVID-19 pandemic, API members have raised $5 million in a short time to support relief activities, including sending life-saving equipment such as oxygen concentrators and ventilators. I'm also told that the API team is working on installing oxygen plants in hospitals serving rural India, with some of these units having been commissioned already. Sisters and brothers, I particularly commend this initiative because improving the infrastructure in rural healthcare is the pressing need of the hour in our country. The government of India, led by our Prime Minister Narendra Bhai Modi, is doing its best, and various state governments are also cooperating and coordinating together to take healthcare to the grassroots level. While we have cutting-edge technology in tertiary care in the urban areas that attract international patients, it is worrisome that rural areas are lagging behind with the limited access to even primary care. In order to bridge the urban-rural divide, I had earlier suggested that we consider making rural service for government doctors stepping out into the field. I had also suggested that we establish at least one medical college per district, and the Prime Minister recently announced it, and moves are on. Open satellite centers of private hospitals in villages and improve health of people by providing infrastructure, particularly at the primary level. In addition to these measures, I believe that we must also seriously explore the use of telehealth and other technological solutions in reaching out better to rural areas and to remote areas. This will expand the utilization of our limited manpower, that is human power, and health infrastructure to reach out the last mile. In this context, we are seeing a welcoming trend of many health tech startups in India. They are also specializing in the areas of online consultation, ordering medicines online, monitoring chronic conditions, and offering cheap diagnostic services. We must expand and scale up these services for rural areas so that the geographical barriers may be overcome and out-of-pocket expenditures are rationalized. The Ayushman Bharat Digital Mission, with a digitized record of the patient's medical history, will also boost these efforts. While technological innovation can definitely ease access, it is not a ready fix to all the shortcomings in public health. There is a dire need to increase the public spending in health. For instance, states should increase spending on health to more than 8% of their budget by 2022, as suggested by the 15th Finance Commission. I am pleased to note that API has started an Adopt a Village pilot program to provide free health screening camps across 5 states, Tamil Nadu, Andhra Pradesh, Gujarat, Karnataka, and Telangana. I am told they are planning vaccination camps in India and with the help of local doctors to address the issues of vaccine hesitancy. These are commendable initiatives indeed. Another important initiative of API is the awareness program for CPR, cardiopulmonary resuscitation, at a time of increasing share of non-communicable diseases, especially those related to the heart. We need a greater awareness among people to apply CPR as a life-saving first aid technique and save lives during heart attacks or near drowning. I believe school children, at least at higher secondary level, and in fact every citizen must be taught CPR along with other basic aspects of first aid. Friends, once again I am very happy to inaugurate the 15th Global Health Summit organized by the American Association of Physicians of Indian Origin, API, today. With the numerous initiatives, API has come a long way since its inception and has proved to be beneficial not only to Indian origin American physicians, but to Indian healthcare as well. Finally, dear friends, in the medical fraternity, as you seek excellence in human health and well-being, do not forget the power of a kind human touch when treating your patients. My best wishes to you all in your endeavors. Thank you. Namaskar. Jai Hind.
Thank you, Honorable Vice President Venkaiah Naidu Garu, for giving such a wonderful message for us. You have set an excellent example for all of us by sticking to the protocols during this uprise in coronavirus cases. Thank you.
Now, may I request the dignitaries to release the souvenir and the journal of the Global Association of Indian Medical Students. I think they are giving, this is inaugural letter, I mean, this journal they are bringing. I request them to bring both souvenir and journal to get released. Please come.
Now, I would request all the dignitaries and including President and all the National OP officers to present the mementos. Thank you.
Switch on this mic, please.
Thank you.
It's working. So may I request now the officers of API to felicitate our guests over here. I think I request Anupama and team to felicitate Dr. Binu Bajpai. Binu. And also may I request, please. May I request the team to felicitate Dr. Nageshwar Reddy. And memento to do Dr. Suryanarayan Raju, please. Now it is the duty of the dignitaries to felicitate the officers of API, and I request Dr. Nageshwar team to felicitate Dr. Anupama, the president of API, and next is the Nagi. And then please, I request to felicitate Dr. Ravi Kohli, the president-elect. Dr. Satish Kottula. Then Dr. Uday Sivangi, the chair of this important event. Please sign your joints and give a clap to Uday Sivangi. I think thank you one and all for joining this inaugural session, and may I request all of us to join for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you very much. I think we will have a break now and we'll join over here at 12 o'clock. And I request all the media people to go to room Orion for a press meet with the president of API and other officers. Thank you very much.